Yes. Hi, everybody. Sorry to jump into this conversation, but it's been a very busy day, and I never know my schedules in these days. So I text Marcel and they say that I was able now have like 10, 15 minutes, and I would love to give you my my talk to all you. So thank you so much for having me. Thank you for the invitation. Just in a quick introduction. So I'm Dr. Andrea Guerriero. I'm a general medicine doctor, and I work in Rome. And with my company, MedInAction, we work a lot with international people here in Rome and in Italy as well. We work a lot also, we collaborate with the American citizens, such as also the consulate. I am one of the doctors on the list of the consulate, and I am here to help the citizen from also other embassies, because there are a lot of situations, and especially in this time of the year, which is very, very busy. Also because, as you can imagine, not only on the COVID-19 situation, but we also have other patients that are unhealthy. So they have other medical problems. So it comes all together, and our schedules are very tight. So just to give you a little bit of what is the layer, how the layer are divided in about the healthcare system here in Italy. So, for example, in Rome and in Italy, we have the hospitals, which are hospital dedicated for COVID-19 hospitals. And in Rome, actually, now we have about 5 hospitals, and they're all dedicated only for this pandemic situation. Um, the patients are brought there only when there are severe cases, because if you're home and you have mild symptoms, it's not advised to leave your apartment. You want to contact your GP, you want to contact your personal doctor for two main reasons. One, because you can infect other people if you're around, and um, if you go in a taxi or you go with a car, and then you can infect other people. And second reason is because if you go in a hospital and there is no need of that, you can catch, because that are hospitals that are dedicated for that disease, for the COVID-19. So the reasons is, if you do not experience severe symptoms like severe shortness of breath, that you cannot breathe, then you don't need to call the 112, which is the 911 in the US, for example, the emergency number. Reach out to your general doctor, which will help you to assess the case, and we'll see what can be next steps. At the moment, the patients become, when there is a link, epidemiological link, they tend to test you. If not, there is the self quarantine. So you stay home and you update your doctor daily. The doctor will usually ask you a few questions about if you had the contact with COVID-19 positive patient, or if you had what's the symptoms. And also you have to track your fever daily, at least 2 times a day. So based on that, what I personally do with my patients is I ask a lot of questions. We try to assess the case. We try to understand if it's been in touch with somebody positive with the COVID-19. If not, then I ask questions about what's the symptoms and then the fever. So based on these symptoms, we decide if we need to call the authorities, like the national health, which is in Italy, in Rome, we have different regional numbers, and then just to be enrolled in the system, or if we need to just monitor the symptoms. Instead, if a patient call me, for example, with severe symptoms like shortness of breath, high fever, they cannot control the breath, it becomes a serious condition, then I'm the one that will call the 112 on their behalf. So, or they can also call directly the 112. And then the ambulance will come, will pick the patient with a special ambulance. Also, all the health professional, they will be covered by a special equipment that will bring them to the COVID-19 dedicated hospitals, where they will do the swab. After they do the swab, usually the swab is ready in a few hours. And then after that, they will be in an isolation room when dedicated the step-by-step per course. And then If the first swab is negative, they tend to repeat the second swab, usually is after 24 hours. And then if everything is fine, or they hospitalize them, or they send them back home and they do the self-quarantine at home. This is let's say the process. Regarding all the international community, they can reach out to me anytime. They can contact MedInAction for the service, and we can help them to assess the case. We also are doing a lot of video consultations. We are doing online consultation. So we tend to do not meet the patient in person if it's not extremely necessary, for the reasons that we can be, there can be a transmission of the virus if hypothetical there is that. And then we answer every day. We're constantly updating up our patients, and we require that the patients give us an update about the conditions. Now that Italy has been in a self-quarantine for these days, for all these weeks, we're starting to see some improvements. There are some good news. So it seems like the situation is getting better. But of course, as all the authorities, and we all say, we need to stay home, because it's really important, because we didn't fight it yet. We just having a good news on the numbers, but it's actually where now we need to continue to follow the rules. We need to be strict. I know it's boring. I completely understand. I am home as well. When I'm not working, I stay home. It's not easy, especially when a family or there are many people in the house, and it can get bored. I know. But what we advise also is try to stay healthy. Like we advise to do activities at house, also some meditation, to eat well. And there are so many other things you can do. Also, you can now, thank God, we have technologies. We can Skype, we can video call our friends, our family members that are far away. Myself, I have my family. My parents are away from Rome. I'm not from here, so I Skype call with them. So there are many ways to get busy. We try to stay busy. And also another advice I want to give you is, do not stay all the time with the news on your computer or on your TV, because they will just go in your mind and will keep you thinking too much. It's okay once a day. Once a day, you get the right information, you follow the right website, which is the CDC, the WHO, Ministero della Salute, Regione Lazio. These are the websites that you want to follow. And then just don't Google too much. There is no need of that. If you have a question about your health, there are medical professionals that can give you the proper information, because now the self-quarantine is becoming many days, and I'm sure a lot of people, they might start to, they want to go out. I want to go out as well. I would like to go out to stay with friends, but I know that now we need to be tight. We need to stay strong and positive, that this is going to over soon, and we want to, but we need to stay all united, but as I say, a part of each other for now.
Absolutely. Thank you, Andrea. Appreciate really you coming out today. I know you're busy. Thanks for making some time for us to speak with some of the American community. Appreciate it.
A pleasure of mine, Marcel. If everybody wants to reach out to me, they can go through our website, MedInAction.com. They can download the app. We are always available. We are here to support and help everybody has any questions in terms of this. I always say, asking, it's the best thing you can do to your doctor when there are some health questions. Don't Google. Google, it's the wrong doctor. It's the wrong information.
And some of the Americans, if any of the Americans have a question and they want to reach out to you, you can also answer whether they have, whether their insurance is taken or not. And then, you can touch on that.
Yeah, we have all the questions. We have all the, you have all the questions. We have all the answers. And even for the insurances, we directly meet with many of the insurances. So we are here, and we've been here for many years now, helping the international community in Rome. So there are few useful blog articles on the website that you can go and look. There is also a very nice mindfulness link that we added. We had a mindfulness link dedicated for this situation, for a coronavirus situation. So please go on the website, go on the blog, a link, and listen to 10 minutes mindfulness that we created exclusively for this situation.